With more on this, Reshmi.
Yeah, so more than 300 people now, Nick, have organized and signed this open letter to the Ford government calling for action. There are 9 calls for action in this open letter, among them ending for-profit long-term care homes. That is something that's being discussed as we see reports from the Canadian Armed Forces in the first wave, and now what we're seeing in this second wave, with the majority of these privately owned businesses dealing with COVID-19 outbreaks and deaths. So to speak more about this, I'd like to bring in one of the founding members of Doctors for Justice and LTC. Dr. Vivian Stamatopoulos joins us now live, a familiar face here on CP24, and now you are part of this group. What about this second wave got you to this point?
It's just been really frustrating to watch other provinces do better and learn lessons from the first wave, and watch our province continue to be hammered in this sector, quite frankly, and not implement the recommendations of not only physicians, experts, advocates, frontline staff, their own long-term care commissioners. And we are now in a situation where we are losing our seniors in long-term care by the hour. And this was predicted to have happened due to inaction. And what we have been warning this government about has unfortunately come to unfold. And this will be a very dark month unless they step up and they do something now to implement meaningful change.
One of the calls is to have the military brought in when needed. Many people like yourself saying the military is needed in many locations right now. I want to play for you what Health Minister Christine Elliott said today at Pearson International on that.
Primarily because we have now an association between hospitals and long-term care homes, and hospitals are standing forward and helping the long-term care homes that are having problems, both in terms of supplying staff as well as supplying PPE and whatever else they need. In certain circumstances, the Red Cross has also been involved. If we need to ask for the Armed Forces assistance, we will do so. But right now we have a system in place where the hospitals are supporting those long-term care homes.
So what do we make of these contracts and orders for hospitals to go in and take over these privately run businesses?
We were warning that the hospitals are not in a position right now, due to their own limits with community transmission rising to the extent it is right now. They don't have the resources to spare. We hear reports from the ground floor that there aren't enough staff, even from neighboring hospitals, to properly step in and assist. We are at a crisis level where the only recourse left is to add these military healthcare teams. It makes zero sense why this government would turn down this free help, that could potentially stabilize one of the 40 of the worst long-term care homes hit right now, with over 100 infected staff and residents. So frankly, those suggestions are ludicrous and offensive to the people struggling on the ground floor to actually keep these residents alive.
Yeah, and so you're getting a lot of support online. I know that you launched today, Doctors for Justice and LTC trending on Twitter. What is the first thing you want to get done with the Ford government? If you had their attention right now, out of your 9 calls to action, what do you think could be resolved right now?
Call in the military, expedite vaccinations, implement infection prevention and control managers at each home. I mean, if we did that, we could prevent what happened at not only Roberta Place, Sunnycrest, St. George Care, Tender Care. These are all documented cases of preventable and widespread negligence that contributed to these outcomes. I mean, this is unacceptable. And we have a government that is refusing to acknowledge that this is happening still 10 months in, and worse yet, also saying that the claims coming from the ground floor are misinformation. And I think that's the most offensive part to those of us on the ground floor who are really trying to help.
And what else have you all been talking about as you organize?
Well, mainly, one of the biggest things going forward is to put an end to for-profit long-term care. I don't think there is any question that there is no place for profit in long-term care. We have a unequivocal body of literature that shows that for-profit on the whole fails these residents. It fails the workers who work in these homes. Nobody wins in the for-profit model except the shareholders and the CEOs. And it's time that we actually take the profit out. It can be done. It's been done in other countries where they reverse the for-profit model and move forward going to a non-profit public delivery model with great success. So we need to start learning from other jurisdictions and other countries who have actually taken an evidence-based approach to long-term care.
And when you talk about the human rights violations in this open letter to the government, they were flagged even before this pandemic. How do we avoid this from happening again without private for-profit long-term care homes? But what else could be done right now?
Well, I've also been pushing, and a few of us have, for national standards. So this is something, and in the national standards, part of the conversations I've had with the Prime Minister's office is that there needs to be an overhaul in the inspection regime and the penalties for non-compliance, right? So we have a system right now in Ontario where we don't ever revoke licenses for bad actors. We have documented evidence of neglect and abuse and failure. And the only 2 times that long-term care homes have lost their license in the past 20 years in Ontario is because of financial mishandling, where they themselves said, take it, we don't want it anymore. So we are in a really bizarre situation where we let these bad actors off with a slap on the wrist, a written warning. And you wonder why we have a culture of secrecy and complacency and nothing ever changes. I mean, I want to see a situation like the US, where you can go after these bad actors with multi-million-dollar penalties, financial penalties that hit them where it hurts and effectively drives them out of the business of long-term care. That's what I'd like to see, in addition to amendments to the criminal code, because I'm sick and tired of our seniors effectively being, abused in too many of these facilities. And this is, at this point, state promulgated genocide. I mean, how else do you put it?
All right, Dr. Vivian Stamatopoulos, one of the founding members of Doctors for Justice and LTC, will continue to follow your work. Thank you.
Thank you.
I'll send it back to you, Nick.